complications: bleeding, injury to the recurrent laryngeal nerve, hypoparathyroidism, thyrotoxic storm, injury to the superior laryngeal nerve, infection, and hypothyroidism. Some ethical issues we have is do no harm, individualized treatment, and thorough risk factor assessment. And with that being said, the benefits of treatment should outweigh potential harm. Individualized treatment should be considered, meaning that patients with advanced comorbidities or terminal illnesses may elect for no treatment. A thorough risk factor assessment should be implemented based on the individual outcomes of each individual patient. For example, an opera singer should be well aware of vocal cord injury, potential with surgery, and comfortable with those risks prior to deciding the treatment plan. Impact on daily life: have physical and mental stress is thought to increase the chances of a thyroid storm. You must try to keep your weight under control, need to be active, diet is very important. Also with the daily life, you have surgical downtime for recovery, potential psychological impact from a physical scar. Some people that impact more than others, but routine thyroid replacement hormone, if you're on that, you have to follow a strict regimen of the medicine, and potential short-term side effects of radiation. If you choose that route, with each time there's complications, and just have to be expected. Overall impact of major life events are minimal. All the short-term, you have to factor all that in, but overall it's pretty good. Impact on significant others: you have an interruption of the normal family routine during the recovery from surgery, and potential monetary impact from cost and downtime. Have to factor in the cost of surgery, which I'll discuss later on. You're away from your job, loss of that money during that time. Have to factor all that in. Also with the significant others, they'll have to help with the diet changes, like I discussed earlier. You have to be healthy, and most of the time that involves a change, a big change in diet. And your family can help with that, help follow that regimen. They'll have to cope with the anxiety. One of the things discussed earlier was the anxiety as a side effect of it, or complication. Families got to get used to that and understand that that's part of the disease process. They'll have to help with the self-esteem if a goiter presents. With that being said, if the goiter is, while it's present, there's a self-esteem issue with that, and then discussed earlier the surgery also with scarring and the whole situation there. There's a lot of self-esteem issues in a lot of people. Treatment, it's widely available. For cost, the average surgical cost is around $11,500. The average radiation cost is around $4,000. Average thyroid hormone replacement costs $50 a month. All of the above is covered by insurance. Prognosis: hyperthyroidism is typically treatable and rarely fatal. However, complications can arise with untreated hyperthyroidism, such as dehydration, systolic hypertension, bone loss with high blood calcium fractures, and abnormalities of heart rhythms. The overall prognosis is good depending on comorbidities, etiology of disease, and type of intervention. You have the surgical, pharmacological, and radiation, which they were all discussed earlier. With a proper diagnosis and treatment, a normal life expectancy with no long-term effects can be achieved. Approximately 100,000 cases of thyroidectomies performed in the United States yearly. The most common complication is the recurrent laryngeal nerve damage, with an incidence of approximately 2%. Damage to the RLN can cause paralysis of the vocal cords. Unilateral damage alters phonation and increases aspiration risk. Bilateral injury can necessitate a trach. Pharmacological therapies also pose a risk for side effects as does radiation. Potassium iodide side effects include skin rash, swelling of salivary glands, metallic taste, sore teeth and gums, and allergic reaction. Side effects of radiation therapy include neck tenderness, swelling, nausea, vomiting, and dry mouth. Also, taste changes are part of the radiation. Undiagnosed cases can lead to thyroid toxicosis with a mortality rate approaching 50%. With that being said, earlier when I talked about the strict regimen, whichever you choose, you figure out the best for you. You need to stick to it because there can be problems with not following the regimen. Follow-up care, short-term care, post-surgical wound management, etc. Anything to do with surgery, your typical surgeries, you're going to have like follow-up care involved with that. Long-term care, thyroid hormone replacement, you're going to have to follow up, checking levels and making sure everything is in the correct range and adjust that if not. It's just going to be a lot of care with the long term. Support groups, have a couple examples here. dailystrength.org, mdjunction.com, hyperthyroidism. It's with the support groups, there's many available online to anyone interested, and just you can Google hyperthyroidism support groups and it brings up a lot of different ones, various. You pick one and you can get involved with that easily.
Some of the problems in plan of care is risk for decreased cardiac output. You need to maintain an adequate cardiac output for tissue perfusion. It needs to be evidenced by stable vital signs, palpable peripheral pulses, good capillary refill, usual mentation, and absence of dysrhythmias. Fatigue is another problem. You need to verbalize increased level of energy, display improved ability to participate in desired activities. Disturbed thought process, maintain usual reality orientation or recognize problems in thinking and behavior. Anxiety, you need to appear relaxed, although sometimes you may not be. You need to report anxiety or problems that if you can't reduce them to a manageable level. And you need to identify ways to deal with your feelings. Impaired tissue integrity, you maintain moist eye membranes, free of ulcerations, and identify measures to provide protection for eyes and prevent complications. Altered thermal regulation, you need to maintain a normal body temperature, provide a cool and comfortable environment. If you're caring for these patients, you need to provide fresh bedding and gowns as needed. Give cool baths, provide cool fluids, and monitor their body temperature. Explain to your patient and family the importance of providing a cool environment, because if you're not maintaining your temperature, that it increases your anxiety levels. A knowledge deficit, verbalize the understanding of disease process and potential complications. Identify relationships of signs and symptoms to the disease process, and correlate those symptoms with causative factors. You need to verbalize understanding of therapeutic needs and initiate necessary lifestyle changes and participate in treatment regimens. Your expected outcome is to maintain a normal thyroid level with treatment. Patients are to reduce anxiety when possible, show improved nutritional status, and display an absence of complications. Maintain your normal body temperatures. And these are our references: U.S. Department of Health and Human Services, and our Lippincott manual. This has been our presentation of hyperthyroidism at Specialty Hospital of Meridian. And again, I'm Ginger Regan. We have Dipti Dahlia, Tashonda Pruitt, and Billy Ward. And I thank you for your attendance. And this, what else are we doing?